And we're live. Hey, everybody. Hi, Jamie.
Hi, how are you, Mia?
I'm good. How are you?
I'm great.
I just saw you last week in New York.
Yes.
I
How are you
did.
feeling? How are you doing?
I feel really good. So it's been a week and a half since my second. I feel like since my last confession. Whenever I say that, a week and a half since my second application of pellets, which the first time was here in Denver, and then I was visiting New York. So I came and saw you all at Advitam and met up with Melissa from Pellicom too. So I felt fancy.
Very fancy. It's a nice office. We have a good setup over there.
Yeah, yes, they definitely do. And Anna's here too. Yay. So I was Anna, we were just talking about you last night. So please, you guys pop your questions in here. Jamie's gonna talk about sort of what I went through. We're gonna talk about the process when I showed up. We're gonna soup to nuts this about hormone replacement therapy. But first, tell me about Advitam and sort of what got you to this point where you are, of how helpful you are.
Sure. So if I take a few steps back, a little bit about myself.
Hmm.
So I'm a physician assistant by training, which I've been doing this for 7 years, going on 8 years. Prior to that, I was a athletic trainer. And for anybody who doesn't know the difference between a personal trainer and an athletic trainers are the people that you see during a sporting event when somebody gets hurt. In, say, a football game, they run out to the field,
Hmm.
they assess their injuries, they tape them up, they stretch them out. So it's a little bit of a sports medicine background. And I did that for a while, working with professional teams, professional
Wow.
football. And then for about 10 to 13, really 12, 13 years in professional tennis, I worked as a trainer with players on the ATP tour and through the United States Tennis Association as well. And I got kind of tired of the travel. It was exciting at first, but I was traveling
Sure.
9 months of the year, coming home for 2, 3 weeks and then leaving again for 6 weeks. And
Mhm.
it got really tiresome. And so it was time for a little bit of a career change. And I went to physician assistant school and got a master's in that, and then went straight into orthopedic surgery because it was kind of my wheelhouse, sports medicine and orthopedics.
Right. They go
And
together.
I loved that very much, and I really enjoyed it. And through all this, as doctors or physician assistants or nurses, we always do continuing training. And
Mhm.
so I started taking training in other areas of interest in the integrative medicine and functional medicine field
Right.
and anti-aging field, and really started to develop a passion for it. And so fast forward to a lot of training, bringing me to hormone replacement therapies and peptide therapies.
Oh, I know. I can't
And
wait to talk about that too.
so I ran a clinic for a while as a director that specialized in men's hormones. And then, my wife was saying, what about me? What about women?
Right.
And then I kind of did a lot more additional training on hormone replacement therapy for women, and
Yay.
started getting busy, and that's how we got to partnering with Dr. David Schaefer, and a really brilliant and wonderful plastic surgeon in New York. He has a clinic called the Schaefer Clinic, and
Mhm.
together we formed this company called Advitam, and we are basically specializing in, yes, definitely, shout out to the wifey. Um,
Bringing you into the fold.
yeah, so we formed Advitam, and that's what we do is we take care of men and women, um, even in their 30s, or some people who have real hormone deficiencies in their 20s.
Yeah.
But the key is you don't really have to wait until post menopause to balance, or we like to say optimize your hormone levels.
Mm.
Um, and I've been loving helping the women. Men are really easy, just easy systems to
I know.
fix, to help, and female systems are much more complicated. But
Yeah.
we've kind of figured out what works, and
Hey.
really excited about it. So
Me too. And I appreciate that because your journey is so interesting. Yes, of like going from, working in sports medicine. So thank you for being curious because kind of
yeah,
that's what got you to that too, of like working in, again, functional medicine and then taking it to the next level. So, yes, shout out to your wife for getting you interested in that. And I think that is one thing that the people don't understand is how we feel that it's complicated, but we're not understood that it's complicated and the questions aren't asked at all. And yeah, Anna says men are pretty easy overall. No shade. Nope, no shade. Just calling it like it is too. Anna saying her favorite physician assistant told me he didn't believe in testing for hormones. I got a similar reaction from my OB. We just talked about that before we hit record as well. So we'll dive into that of what questions to ask and how to ask them to get your needs met.
yes. You're going to find that, unfortunately,
Mhm.
it's this gray area of hormones and hormone balancing,
Mm.
and it's kind of outside the box of traditional medicine. And traditional medicine is more, uh, we don't address something until it's broken, rather than why don't we be proactive and optimize the system so things don't break.
Yeah.
And so it's not that they're bad doctors or PAs or bad OBGYNs. It's in medical school or PA school, they don't really train you on this. They didn't train
Mm.
us on, they trained us on OBGYN and hormones and how it relates to pregnancies and things like that, but never
Yeah.
about anything about optimizing or balancing hormones. And so um, typically when a doctor doesn't want to test something, it's because they're usually know that they're not the one to treat it, or they don't feel comfortable treating it. So they may not know exactly which hormones to test, because there's a bunch of them. Or once they run tests, they kind of become responsible for what happens next with those. And if they're not going to be the person to address the issue, they kind of don't want to deal with it.
Right.
So I think it's best to find someone in your area that is pro hormone, and that doesn't mean they're
Right.
going to push them on you. It means that they'll have the knowledge in the background
Right.
to really assess you better.
And I appreciate that too of like of being educated, of knowing what to ask for. And you would said that, like I said before we hit record, of that they're going to be hesitant to order these tests. It's kind of like you touched it last almost.
Right. Yes.
Like, and they don't want
Hot
to
potato.
yeah, exactly. They don't be responsible for it. But and I also appreciate too that and we'll talk about this as we wrap up too with Schaefer Clinic, like what they're doing, because it's in the same building, then you guys are right above. So there's just like this full circle thing going on for different treatments too. And then you mentioned, and this I really like too, and I would have never thought of it because I'm 56. So now I'm finally starting to address what I've been going through. When we talked about this, when I sat down with you for 7 years, like, I just was kind of waiting for whatever that social signal was to say, okay, I should get this looked at, but then also told, well, this is just kind of how it is.
Right.
And
Yes.
that happens a lot too. But you mentioned even, maybe taking a look at hormones even in as early as the 20s or 30s.
Yes, sure. I think it's about listening to the patients. If they
Hmm.
start describing things that could indicate that there are hormone deficiencies, regardless of their age, you should test those panels.
Yeah.
Um, and if you're comfortable testing them and know
Hmm.
what to do with them. I've seen people, again in their 20s that had no hormones, and
Wow.
sometimes just balancing that fixed so many things. Some of their chronic fatigue problems or illnesses. If you think about it, typically, if everything is relatively normal, we feel our best and look our best in our, early 20s, early to mid 20s. And that
Yeah.
is typically when our hormones are functioning at their best. And so there's no reason why we can't, optimize the hormones a little bit later on in life so you can continue to feel good and function better and look better. And there's also benefits to prevention of some chronic diseases by keeping the hormones balanced and optimized. There's really
Yeah.
good studies that show it could be cardiac protective, prevention of Alzheimer's disease,
Osteo.
increasing osteoporosis,
Hmm.
increasing serotonin release.
Mm.
I've
More pleased.
yeah, I've gotten people off of sleep medications just by balancing their hormones. You know,
Hallelujah.
yeah.
So we have a couple comments. So we're going to pull these
Okay.
up and then we're going to go through the process that I went through with that too. I like, look at Rita. I love that. So she said she's used a vaginal moisturizer every few days and a supplement that got her orgasms back. Go on that one, Rita. That's amazing because that is one thing I know when you ask questions when we sat down and talked and asked a lot of, pretty private pointed questions, which I'm completely fine of talking about because you've even said there's a lot of people that just thought it was normal, like lack of libido and vaginal dryness and thinning walls and discomfort. We just thought that was kind of how it goes.
Yes. I think we were talking about it, and sometimes, I ask those personal questions, and I ask
Mm-hmm.
people, how is your sex drive? And sometimes I do get the answer, oh, it's okay. It's not, it's not bad. It's all right. It's good. It's fine.
Mm-hmm.
And then after, adding the hormone pellets in, and they come back 6 weeks later, they say, now I know what you mean. It wasn't fine. I was just used to it. I was used
Yeah.
to going through the motions.
Mm-hmm.
So,
I'm giggling like a 14-year-old, but it's so true. Like you just kind of think that was it, and they come back and they're like, "Oh, wait a second, that
yeah,
that that wasn't normal at all." Anna, I love this comment that she made too. Traditional medicine, yeah, it can be about deficiency of just what's like you said, what's not working.
yeah.
And real quick question. I would so she says, does that mean I have to look for a holistic doctor when you're saying too of like about hormones? Talk about that real quick and then we'll go through my process.
Sure. I think a good way to look up doctors are under the heading of integrative
Hmm.
medicine doctor or
Yes.
functional medicine doctor. Many of them use holistic approaches, but they're also MDs or DOs. So they prescribe medicine as well, but they're much more into anti-aging and hormone balancing and IV drips and those other
Hmm.
types of treatments that are kind of outside the box. Yeah.
And I appreciate those words. I think those are things we don't functional, yeah, and integrative or people don't even think of. Louisa wants to know, how do you know if you don't have any hormones?
We do some blood tests. There are other tests too. Some
Mhm.
practitioners use urine tests.
Mhm.
I like to use blood tests,
Yeah.
and there are various different blood tests that are run. So there would be, we would look at testosterone, we would look at estradiol and
Mhm.
other types of estrogens as well,
Mhm.
progesterone, and then something that's very important that sometimes gets neglected. And again, this is why sometimes your primary care docs don't go into this, is they might not know to run this test, but it's called sex hormone binding globulin.
Okay.
And the reason for that test specifically is if a doc just doesn't do this, but just says, fine, I'll run your testosterone for you. If you don't do the sex hormone binding globulin test, you don't know how much of their testosterone is available for their body to use.
Ah.
It's also, if you've heard of free testosterone, that's kind of a way to assess that as well. But the more having this other test is really going to tell us a lot. So in other words,
Mm.
you on your paper, it may say, hey, my testosterone is normal in that normal range. But if you look and some of it is, or a lot of it is bound up by this other molecule, it's not really accessible by your cells and it's just kind of
Mm.
randomly floating in your blood. So So there's various blood tests, and really the best thing too, besides the blood tests, are a really thorough, comprehensive discussion and consultation I was always trained, treat the patient, not the labs. How are you feeling? Do you have sex? Your hormones may say they're okay on paper, but if you're having hot flashes or have no libido or have vaginal dryness, sometimes we can treat without the paper saying you absolutely need it by those values that were set umpteen years ago before anybody really cared about optimizing how somebody works.
And you're right. I think a lot of it does go with some of the old mindset type of thing too, of like, this is just what we checked. And the important thing as well, and this is where you and I, when we not only talked on the phone, but then we sat down when I was there, is that everybody is different. Right. So
Absolutely.
the other things that I had, and this is an interesting thing, I think, for women, which is why I had that podcast shit we don't talk about, is because it's not talked about. So there's
Yeah.
just these overall things. So I know anxiety was a tough one for me as well. I got a lot more anxious. I had sensation issues. That was my perimenopause, night sweats, but not hot flashes, and brain fog. Actually, so I haven't told you this yet, but I know that you're working with Peter Shankman, right?
Yes.
So
Yes.
Peter Shankman was like this lead up to me actually discovering I was in perimenopause,
Oh, wow.
which is funny because I interviewed him about ADHD. He had
Okay.
just started that podcast called Faster Than Normal. So he's
Right.
talking about all of these different things. And I was like, holy shit, I have ADHD. And I literally just couldn't get like what was wrong with me. Why my brain fog, I just couldn't get it together. Well, then when I went to the doctor, she's like, no, that's perimenopause. That's part of it. So I think I was like 48 or 49, but it all started with an interview with Peter Shankman, who is a client at Schaefer and at Advitam. I've seen him post
Yes.
about it.
Yes. And he's posted about it. He's doing really well. And just some insight about
Mhm.
him. He was a naturally heavier type of person,
Mhm.
and has really struggled with his weight for quite some time. Um, and he was very motivated,
Mhm.
and
He's very open about it.
he's very open about it. He
Mhm.
gives us full disclosure to discuss his
Mhm.
situation,
Mhm.
and he's become very dedicated. And we have him on a few different plans that we offer there, but hormone replacement therapy is one of them. And he's also dedicating himself. He's
Yeah.
taking advantage of it. That's the other part. We
Yes.
give you
Talk
the
about that.
fuel, we give you the tools, but what you do with it, is really what can kind of if you want those other results, besides just sex drive and the internal results, if you want to change your appearance as well, you meet us halfway and put some of the work in, and Peter's done that. So
And I can tell, and I know for myself too, because we'll talk about Pellicom too. I'm taking their supplements as well. So yes. So I started. I met Melissa in May, and I got my first round of Pellicom shots in the middle of May. So then I saw you right at just about 3 months. So that was interesting too. So I got the blood work done, and Anna, we'll post some links in here when we're done. Jamie can come back, and if you want to comment and talk about some of these tests as well. So I got my blood work done again. I sent that to you, and you took a look at it, and then I came in. So we can kind of walk through what happened next, because I came in last week and we sat down and really went through a lot of stuff.
yes. So you want me to go? Well, first, if for anybody who's you're hearing us throw some names around, and
Mhm.
and just to get an idea of what Pellicom is, and
Mhm.
the hormone pellets that we use.
And why you
Um,
use them, because I know you've looked at a lot of
yes.
companies.
Yes. So bioidentical hormone replacement pellets, they're made in a lab. All medications are, but
Mhm.
what makes them bioidentical is how the body uses them. When you put something in the body, they're metabolized through pathways. And I think they're made from Mexican wild yams, so it
Mhm.
is plant-based. And whether it's estradiol or testosterone,
Mhm.
uh, the pathways that the body metabolizes them through are identical to the pathways that your natural hormones will metabolize. So there's none of the issues that people that frightened people, such as years ago in the 90s when synthetic hormones were being pushed pretty hard. They were not taking the correct pathways in the body, and they were causing irregular cells to grow and multiply, and that equals cancer. So, and that's why I know I'm veering off a little bit, but that's why some traditional docs or docs that don't do this for a living are really apprehensive and scared, because they haven't really kept up on the current research, which is very supportive of bioidentical hormone replacement and its safety. And so anyway, Pellicomb took this a step further in how to develop an excellent delivery system for the pellets, which makes the life of the clinician better and the experience for the patient much better as well. And that's really important, because using other types of systems, and I've used them, it's difficult. It's not as smooth. You're pushing these pellets through fat tissue, which isn't like going through water. Things get stuck. So Pellicomb designed this brilliant system. It really is. And I know it sounds like a sales pitch, but I love it. I really do. And I wouldn't do the pellets without it.
I appreciate that. Was what was cool, talking with Dr. Roeder here in Denver, and then speaking to you about it. You both had experience with it before, so you know what works and what doesn't work. And I did post a video of it, y'all, that you can see it. If you're a little squeamish, I will tell you, it doesn't hurt. It just looks pretty crazy, but it's so cool. Like all the little kind of gun thing that makes the insertion, makes the cut, and then the gun itself. So it really, it's pretty cool to see. And I mentioned this last night, y'all, that actually Pellicomb works with women-owned businesses. Like, just everything about them is just super above board. And then you totally dig Dr. Jacomb, who was the OBGYN who came up with the pellet system.
Right. And so that's the other part of it. Not only is the delivery system excellent, Dr. Jacomb has been, he's an OBGYN, and he's been doing hormones and hormone replacement therapies for, I think, about 30 years. And what you get from that is somebody who's already learned by a gazillion mistakes. In medicine and in anything, you get good when you learn how to deal with problems, whether hormone levels came out too high, or so he learned how to make these corrections and made it easier for all of us other clinicians by creating a system that has algorithms to help us. That's why we ask you so many questions, because we can put all that information in, which is going to help us to properly dose you. So, much less likely to overshoot on dosing using the Pellicomb system.
Right. And that was what was great too. So Anna wanted to know, she said, how long does this last? And so between 3 and 4 months, and we talked about that. So this was kind of cool too, because I started on the lowest form, and that's where I appreciate the lengthy conversations. Is you and I talked, and Melissa was there too, so we got to kind of come up with, okay, would you like more testosterone? Like, how would you feel? And so we sort of sussed it out based on what was going on, because I think you saw my initial blood work, and I was like at a flat line because I am postmenopausal. Can you talk about that real quick, about the various stages of menopause?
Yeah, sure. People start becoming symptomatic premenopausal, and that can range from anything from moodiness to hot flashes, irritability.
I had sensory issues, Jamie. It was very odd. Like I was like socks on my feet felt weird. Like, it was just like, what is wrong with me? So I think it's good to bring up all the different ways it can present.
Yes. And I think one of the more common ones too is unwanted weight gain. Everything you've been doing, such as you eat well, you exercise fairly well, and then you've done nothing different, but all of a sudden you're gaining weight, you're gaining fat, you're losing muscle mass. Those are some signs, as well as sometimes cognitive and memory decline. So And what happens really is your ovaries are starting to not do what they primarily do with making your hormones. And through that process, once you hit menopause and go post-menopause, the ovaries stop producing your hormones, and then the adrenal glands, which sit on top of the kidneys, start picking up the slack. And then and they don't do as good a job. They don't produce hormones as efficiently, and then they start overworking. So then you start getting signs of adrenal fatigue.
Oh,
Yeah.
wow.
So yeah, these are the things that can be helped. There's something we can do about it.
Sure. And then a question too, I know people have asked me, how long then? So I am 2 years out, so postmenopausal, but definitely this is helping. And you're right that the trunk fat, I think they call it. Oh, dude, that kicked my butt because I just was always able to do this very specific thing to if I ate too much or drank too much or whatever, I could quickly shift back into my normal. And I thought it was the pandemic at first. I thought it was COVID weight. But then in the last year and a half, it's been a pretty dramatic shift of even where the body fat is. And I don't want to talk about that from a shaming perspective, just what
Yeah.
my normal was. I want to be very clear about that too. So that hit me.
Yes. Quite a few people have come in over the last 3 to 4 months and have this same story. I don't know, since COVID, since the lockdowns, since I haven't been doing stuff, I've put on all this weight. And then we get down to it, and some of what they're experiencing really started before COVID, but because of this pandemic and the lack of activity for a certain period of time, people really started to feel it almost brought them in to us. So uh,
Yeah.
helped us identify something.
It definitely did. Anna, thank you for all your comments too. And I know, what was it? Rita says, listening, friend who's like a daughter kept telling her doctor she felt like she was going through menopause. She was in her late 20s. It took 3 years for a doctor to finally diagnose that, yes, she was going through menopause.
Yeah. Yeah, and
It's,
I'm looking at Anna's comments also about
yeah.
their PA doesn't believe in adrenal
Oh,
fatigue.
yeah. I was going to bring that up and watch you kind of come unglued a little bit.
Yeah,
Like,
I mean, look,
everybody's different.
everybody's different.
Mhm.
Your PA may be excellent in some other areas, and maybe they're just, this isn't their subspecialty, the hormones, and
It's
that's
a nice way to put it. I
that's
like that.
okay. It's just maybe, it'd be a good. I'm not sure where you live, but I'm sure we can help you find somebody who can run some good tests for you. We can definitely
Awesome.
probably do that.
And I think you're in upstate New York, sis, right? So she is in your neck of the woods for sure. That's awesome. And talk more about how people can, in addition to if they're in the area, come in and see you all, how they can advocate more because I know all of us kind of turn into armchair doctors in a way. I don't know if that's tough if they come in too prepared or how can we be better prepared when we go in, not only for our physical, but to explore that a little bit further.
So I think if you're considering hormones and you think you're in this perimenopausal or
Mhm,
menopausal,
mhm.
if you're in your 40s and you're experiencing any of this stuff and you're going to come to somebody like me, some of the best things you can do to speed the process along is have recent copies of your mammogram reports, pap smear reports, and if you've had any pelvic sonograms, because that's part of, if we do decide to move forward, that's usually what we want to look at to make sure there's no problems, with any
Yeah.
of those reports, so that we're safe to proceed. So even having those tests done prior to coming to see someone who's does hormones would be
Mhm.
amazing. Then we
That's
can
awesome.
streamline the process. But and then it's as easy as just calling, setting up a consultation.
Mhm,
I know if it's our office, we tell you to fast so that you come
mhm,
in fasted, and we take some blood and we put you, we do a basic physical exam, listen to your heart, your
mhm.
lungs, your blood pressure. And we put you on a body composition analyzer, which I think Mia went on it, right?
I did do that. I've have that actually. I'll post the links of that. That was cool. It was, what's that company
It's
called?
really good. I use a company called InBody, and
Mm-hmm.
I think the machine is an InBody 570. But you stand on this machine, there's
Mm-hmm.
electrodes on the bottom, and then you hold on to these other electrodes. You don't feel it, so you're not being electrocuted, but it sends, some sort of sound wave signals through your body, and it's
Mm-hmm.
really efficient. It tells us how much body fat you have, your percent body fat, how
Mm-hmm.
much skeletal muscle you have, how much organ fat you have.
Yeah.
And as sometimes people are sad to go on it the first time. When we keep using this machine with our follow-ups,
Mm-hmm.
it's been amazing, because a lot of times the patient is ready to give up
Mm-hmm.
quicker, because I talk about this a lot, so it may sound redundant to me, but if we put you on, we balance your hormones, and one of your main goals is, I want to lose weight.
Mm-hmm.
And then, 6 weeks, 3 months later, you've only lost 2 pounds, 3 pounds. If we don't use that machine, people become discouraged. But when we
Mm-hmm.
look at it on the machine, sometimes we realize you lost 10 pounds of fat, but you gained 6 pounds of muscle. So it only appears that you lost 4 pounds,
Ah,
but you've completely converted a body composition. So
it's
that's
really
why that
cool.
works really well. And it's been really invaluable.
Yeah, it was so comprehensive, y'all. I'll post the picture of it, because that for me too, that pinpointed some things as well, because we do sort of again follow the social norm of like, your body weighs this much, but you're not looking at what weighs what. And that was pretty eye-opening. That was
Yeah,
kind of cool too. Tell me about some other cool things, because we talked about peptides and all that, and some other neat things that you're doing at Advitam specifically.
sure. So we also do peptide optimization, which, peptides is a really broad subject, but there
Mhm.
are, I'm on live, Christina.
Mhm.
I'm sorry.
Yeah. Oh, no, it's all
Um,
good. You're talking
uh,
to us on the weekend, which I appreciate.
so peptides, there are various peptides that do different things, and some
Mhm.
peptides signal your body to release growth hormone.
Mhm.
Other peptides can work on improving brain function or wound healing.
Wow.
So typically, a lot of people, and what's most common are these peptides that release growth hormone, but
Mhm.
also, hi everybody, this is my wife, Christina.
She can't
Hi,
say anything. Hi,
Christina.
how are you?
Good, how are you?
Good, thank you. Can I
Um,
Talking
just have,
hormones.
I need to
I'm,
know what my sister wanted.
I'm sorry, just one second.
No problem, no problem. Y'all keep your questions coming in here too. We'll answer that. Go ahead, Jamie.
Just-
Give me
Oh, he's gonna come back in. Um, oh my gosh, so much good information. So I'm gonna post the link to Pelicom as well. So depending on where you are, and you got to give a shout out to the wife who is the reason why Jamie got into this in the first place, which I love. So, depending on where you are, I'm going to post the link to for here it comes. I'm going to post the link for Pelicom, because you can just go on Pelicom's website, and there's an article, or actually there's an interview with Dr. Jacome talking about sort of that history. Jamie, I'm glad you brought that up about the history of hormone replacement therapy, and
Yes,
how off the rails it went. And then if you're
absolutely.
not paying attention, people just see hormone replacement therapy, not the bioidentical piece.
Yeah.
Yeah.
Um, and if I just jump back to peptides for a
Yes.
second,
Yes.
these
Mhm.
so this has actually been amazing that we add this in to really hone in on certain things. So our bodies start losing growth hormone also in
Mhm.
our 30s, and growth hormone is responsible for, it's been thought of as the longevity hormone. It's responsible for
Ooh.
why our skin looks good, why
Mhm.
our hair looks good, why we had the ability to metabolize body fat in our 20s, even though we probably partied the most at that age and did
Take
the
the
least
worst
amount of
care.
exercise. Right. You take
Yeah.
but you still look your best. And so what's nice about peptides is they signal your body to release growth hormone rather than us giving you actual human growth hormone. So this is a much safer way to do it. Um,
Yes.
Yeah, and when we used to give actual growth hormone, there's just a window of good, and it's very easy to overshoot that window and go a little bit too far. So the peptides are an addition to, different plants for, and for different reasons. There are some that we use also for weight loss, and that work really well together. So
that's so cool.
Just a couple programs we have.
And you're right about it being a very sweeping word with peptides. Like when I hear that, I don't think of what you just described as well. So I really appreciate that, because I think it does kind of get into this like peptide serum that you see on L'Oreal, and that's kind of it too. So
Yes.
I got to come back to New York, because I know I got my blood tested too. Because I want to have you guys do all that. So that's going to be my new thing.
Sure.
That's going to go back out to Advitam and go check it out. So, all right, tell us where we can find you. I know you guys are putting out a ton of great content as well. So where can we follow? And I'll put the links in here as well.
Sure. Our website is myadvitam.com, and on Instagram we are advitam.health. Advitam is Latin, which means to life, or cheers, like for life, to life. So there was where we got that from. We're also on Facebook. And we are located on Fifth Avenue, between on Fifth Avenue, on 44th Street is the entrance, and it's Fifth Avenue between Madison and Fifth.
Oh, and Fifth. Yes.
Yeah, so it's between Fifth and Madison on 44th Street. So
right down from, you can see Grand Central, y'all. Super, super fun located. And again, so you guys are up higher, and then Schaefer Clinic is right below too. So I love how you partner up on that too. So that's pretty exciting. So thanks for all the good info. I'm going to bring up one more thing, and then we're going to get out of here. If hormones shift all day, how do you pinpoint it so the blood test nails it?
Yeah, hormones do. You're right. Where typically you release the most amount of hormones at approximately 2-3 a.m. in the morning, and usually practitioners aren't coming to your house to test them at that time. But we try to test them early in the day, early in the morning. So we try to get those 9 o'clock appointments in. And they don't fluctuate that much between one day. In other words, it's easier for a second if I talk about it from a male perspective. If I test the male's testosterone and he's 200 at 9 in the morning, he's not going to be 700 at 3 in the morning. There'll be some fluctuations that are relatively small. So we can get an idea based on when we test where somebody should be.
And I really appreciate, and we're going to wrap it up, that you're saying that people getting all those tests, like you said, like getting, checking out your breast exam, making all these, having all that done, because we even had to do that with me, because I had an abnormal pap smear, and I had to get, I can't remember what that was called, a colposcopy. Rooting around is what I'll say it was, but everything came out fine. And then that's how we knew I could still continue. So I will encourage everyone to really, really take charge of your records, because I just changed over from one doctor to the other, and I'm having a really hard time getting all my records. So now asking for it. And I think there's really something to be said for having everything lined up for yourself and knowing exactly where you're at. And then you can hand them off to someone like Jamie. So
yeah, sounds good.
Yay. Thanks, everybody. Thanks for tuning in and all the good questions. We appreciate it. And then I'll put all the links to everybody where they can find Jamie. So thanks, everybody. Thanks, Jamie.
Thank you. Bye.